Good morning, everybody, and welcome back to your Lunch Break Live. My name is Ivana Harinque if you're new here, and if you're not, thank you for coming back. Today is Thursday, June the 30th, and today we're talking about something that we've been talking about a lot over the past couple of years, and it seems like we're talking about it a little bit more lately, and that is COVID and the case numbers happening around Alabama. Today, I am joined by our reporter, Leada Gore, who has kept us up to date with all of these case numbers and case counts throughout the past couple of years. Leada, I hate even saying that sentence, like adding years onto the end of that, because I remember when we first started doing this, we were saying, a couple more weeks, and here we are in 2022, and we're seeing more spikes. So we're going to look today at some of this data from the Alabama Department of Health, from their public reporting website. We'll also leave the link so you can look at this dashboard and kind of play with it for yourself and look at those numbers. But Leada, right now, I know you and I were just talking. It seems like everybody knows somebody with COVID right now.
We do. It does seem to be very similar to last summer, right before the 4th. It ticked up after Memorial Day. It ticked up after the 4th. And I think that's just a pattern we've seen since March 2020, which is mind-boggling if you think of how long we've been dealing with it. However, our reaction and our treatments and our vaccination and all that has just changed the whole landscape of how people deal with it and how sick people are getting, which is great news.
Well, and you and I were also saying that we were talking before we got on about this variant, right? So the subvariants going on right now, it's a subvariant of Omicron. We'll talk about that more in a minute. But it seems to be that this subvariant is extremely contagious, as we know that Omicron was earlier this year. But while case numbers have gone up, hospitalization rates have not completely exploded, which is good news in this.
Right. Yeah. Now, what you get is... I can't imagine the science involved with tracking all this. It's amazing. But those two variants, BA4 and BA5, are now 52% of the cases nationwide. So this is, again, we've seen this ever since they started tracking. You would see it tick up. It'll be like 3%, 4%, 5%, and then it's just like, boom, suddenly it's 50%. What we have seen since Omicron stuck around a little longer, but these other ones have just spiked and then they go down, spiked and then they go down. And that's, I think, what we're going to see from the beginning. You see a lot every time of, this is what makes this variant different or worse or whatever it is. But the truth is, in my limited history major brain, is that the more it spreads, it can weaken in ways so that we're not seeing the massive illness. And I think some of it is we're not seeing people, you've got built-in immunity, you've got some people who are vaccinated. There's more ways to treat COVID now when we didn't have anything before. So I think you see the whole landscape change. Even when we see an uptick, you don't see as much just gripping fear from it.
Right. And right now, again, we were saying that we all know somebody, it seems like, with COVID, and we also seem, though, to be reacting differently to that news. Let's rewind a little bit in 2020, or even some last year when we had several of these variants, especially before vaccines. We would hear, maybe if we'd hung out with somebody, that they had COVID, or several people that did, and it seemed to be a little bit of a mad dash for tests, a mad dash to figure out what should I do, who should I be around, what are the CDC guidelines. And while people are still doing that, it does not seem to be the same level of panic or induce the same level of panic as it did before. Again, because so many people are vaccinated, are boosted, do know how to manage it. So right now, I want to pull up a map here. And Leada, I want you to kind of tell us a little bit about this dashboard. If you've been keeping up with it since it began in 2020, it looks very different. The tabs are different. There's a lot of changes here. So I'm going to pull up this one tab that I think is really interesting. Leada, can you tell us a little bit about these colors we're looking at? I'm going to try to zoom in so it makes a little bit more sense.
This is the most complicated website in the history of websites. We sent people to the moon easier than reading this website. But I understand why it's like the way it is, because it has so much data poured into it. But it is not easy to use. This shows community transmission throughout the state. Now, it is completely reasonable that your community transmission is higher in areas of heavy population, Madison, Jefferson, Shelby, Baldwin. That's pretty normal. So your red, I think we had 10. The 10 counties are high transmission. Your yellow counties are moderate, and obviously green is all good to go. The interesting thing is, previously, we saw more issues in Alabama's Black Belt, like the far western part of the county. I mean, the state where they were really having high positivity rates. And so that's good news. We're seeing some, some lessening in those areas, which is wonderful. One thing to keep in mind, when this dashboard was first created, if you remember, again, we're like walking down COVID memory lane, but if you remember, getting a test was like an issue. Like you had to go and you waited in line for 2 hours. And so tracking your positivity rates was a lot different. Now I have 6 tests in my cabinet and I can be tested in 5 minutes. But if I test positive, even though you are supposed to report results, nobody's doing that. So the effectiveness of the data gets lessened because people are in charge of their own data. Perfect example, our positivity rate is 24.8. So basically 25%, which means 25% of all the tests that are being administered through healthcare facilities are testing positive. That's very high, but we don't know if that is actually correct. It could be a lot higher. We just don't know because people aren't going to get tested right now. They're testing at home, which is great, which is wonderful, but it doesn't make the data accurate.
Right. And even if people are testing at home, sometimes people are also just not testing. As we said before, if you're exposed and say maybe you are vaccinated, you're boosted and you aren't showing any symptoms, then you are continuing your everyday life likely and not taking that test, even if you're taking it at home. So again, that can make the data a little bit muddy. That just is a lot to kind of factor in when looking at this map. You can look at some of the green counties here, which again means the low county transmission according to the Department of Health's data. And you look somewhere at, say, Pickens County, right? That is a green county. Green meaning go, right? With the low county transition level. So being that color, that you have to kind of keep in mind a little bit. It's not that, Pickens County, Marion County, Lee County, it's not that they are immune to COVID. It is just that, there's a high likelihood people, again, as you mentioned, are not getting tested, or people are getting tested at home, doing their own tests and not reporting it. And Leada, we should also be fair here. Even if you do want to report it, there's not really a streamlined way to report your at-home COVID test.
I can't imagine. And as much resistance as there has been to everything, I can't imagine if you set up a website to report it, that would be a whole other disaster. So I think the good part about all that is, though, it really did put healthcare more back into the individual's hand, which I think is great. But it's up to the people to really be responsible. I love the convenience of an at-home test. If we went on vacation in March, we had to take them. And it was wonderful because, you had your answers right there. And that has changed a lot. But it does make the data harder to really, it's almost like looking at a poll that tells you who's going to win president and they sample 1,300 people. That's not going to tell you everything you need to know, but it does give you an idea of where we are. So we've seen our positivity rate go up. We've seen our case numbers go up. But on the plus side, while we are seeing hospitalizations slightly move up, let's see, we had 430 hospitalized as of yesterday, which is up by about 6 or 7. We were in the thousands, before at its peak. And so, I always caution people not to just act like it's done, because it's not. And I have family members, you probably have family members, we all do, that if they were exposed could really, it's dangerous. They're elderly, they have other health conditions. But I think one of the things that we deal with now is, like we have talked about, people are just done. And they're not going to live in such a way that just limits their daily activities. I also think this is, I've seen this covering issues for years, is that whenever you have a time of economic crisis, people tend to put other issues on the back burner because the economic crisis affects their daily life more. And so I think when you're paying $5.50 at the gas pump, you don't worry as much about other things because you're just worried about supporting your family. And I think that has a lot to do with it. There's just, and it's fatigue. I still think one of the most interesting things when we're 5, 6, 10 years down the road will be sort of the forensic analysis of how we covered COVID, how we reported on COVID, and how the data was right or how the data was wrong. And I think that will be fascinating. On the plus side, or I shouldn't say on the plus side, on the thing before you think I'm done with it and I don't care anymore. If you have people who are at risk, you need to take those extra precautions because we are seeing COVID numbers increase. That is the bottom line.
Right. Well, and two, I want to address a couple comments I've got right now. I have one, and they're coming in so quickly. Excuse me if I missed your name, but I had somebody said that she and her husband both have COVID and they know about 20 people with it. And she said they're in a county that's labeled as green on this map. So perfect example of how some of this data is getting a little bit muddy. Also, several people saying that they are on maybe their second, maybe even third round of COVID. So we do, from what we've heard from our scientists and our medical community, is that, again, this kind of helps lessen that hospitalization rate as people have been more exposed, as people have maybe caught COVID once before, a different variant. Now their immunity is a little bit higher, and it makes the newer variants, the sub variants, and then maybe the second time you've got it a little bit less severe just because of the way that virus works. Also, a couple of other questions and comments here is somebody had mentioned, Birmingham is about to host the World Games starting actually a week from today for 10 days. And somebody said, look, yes, Birmingham's going to host the World Games smack dab in the middle of Jefferson County, all those venues in Jefferson County. There might be one that borders on Shelby. And at that point, what are the precautions that are being taken there? And what about the people who are coming again from overseas, from other countries into Jefferson County, which by this data is labeled as a pretty high transmission rate?
Yeah. You look at how that has changed from when they had the Olympics and had no people in the stands. And I think it is just the straight up, you're going to see outbreaks related to that because you have a gathering of people. But at the same time, you would be sort of disingenuous if you said, we're not going to host the World Games, but we're going to pack 110,000 people into Bryant-Denny Stadium last year and just hope, and because we're watching football. So I think those sort of large crowds of people sort of paved the way for the World Games and for other groups, because I have yet to hear in my own life recently anything canceled or changed or even really changed because of COVID. We were discussing the other day about the only place I wear a mask now is the doctor's office, which is probably a good idea from here on out, just because you're at the doctor's office with sick people. So I don't think you'll see, we'll probably hear of outbreaks related to the World Games. Personally, with the World Games and coming in from all over the world right now, COVID's already here. Monkeypox is not. I'd be more concerned about monkeypox. But there you go.
Don't give us anything else to worry about, Leada.
I'm right about that too.
So what I'm going to do here, I'm going to pull us back here, and I want to look at a different one of these tabs on the dashboard here. So let me look this up. And while I'm doing that, to look at one of these other tabs from this dashboard that, again, we've been looking at now for several years. Tell us again about our statewide positivity rate and our statewide hospitalization rate.
Yeah, statewide, and I have to look at my notes because I can't remember the numbers that well. Positivity rate's 25%. We used to consider 15% sort of the margin of highness. You test less people, and it's the law of averages. You test less people. Those people that are going are probably already know they're positive. So that doesn't shock me. But our hospitalization rate is 430. We don't get quite the breakdown that we used to get, because if you remember, we used to get age, and it may be on that website. I'm just not poked around enough to find it. We used to get more of that information. We are little over 50% of Alabama's population is vaccinated. We are behind the country, which is about 67%. So we're still, I don't know a figure unvaccinated but have had COVID. And, I think the research is still sort of out there of how long those antibodies last. But again, no expert on herd immunity, but that does play a role. If we've got 50% vaccinated and we have some herd immunity, that's a great graphic right there. Is that the hospitalization one?
This is the
Number
actually
of
the
cases.
daily moving average of
Isn't that
cases
fascinating?
from this year. So you can see again, the cases is this kind of light gray number. The 7-day
Yeah,
average is this kind of purple number. So you see how
yeah.
much of it spiked in the winter, again, coming out of December and into
We forget. Yeah, we've forgotten what that
yes,
was like.
exactly. You forget into 2022, and then you can see the really leveled out of both the average and the cases. You can see there in kind of end of February, March, April, and then kind of at the beginning of May, and you see the uptick now. But something that we should note is even though we're saying that there are so many cases going around right now, if you look at these June numbers, compare that to
Oh
the
yeah.
winter numbers, and it's not comparable.
And a lot of that, again, we absolutely could be at that high rate now, but because people are testing at home, we don't know it. But that also means, like, if you think back to March 2020 when, we were all going to stay home for 2 weeks and flatten the curve, there became a lot of discussion as we got into 6 months and 8 months that we will eventually look at COVID as a chronic issue, like we look at the flu and a cold and that sort of thing. That's just always there, kind of boiling around, and we learn to live with it. We're seeing that happen now. That's what we're seeing happen. It is part of daily life. Yes, there are sadly going to be people that pass away. There are going to be sadly people that are hospitalized and are very sick. But it becomes part of a routine as opposed to, the pain. I mean, it was terrifying. It was terrifying. Are you sick? What are the rules? Can you be around somebody? And now, I mean, I think we're down to 5 days quarantine, unless you don't have symptoms, and then you eat a ho-ho cake and you're okay. I don't even know what it is anymore. So it's kind of like, I don't think it's necessarily, the government changed because they don't want to scare people. No, I think it's just science. You learn more about things. And some of it is trial and error. I mean, that's just part of it.
Well, that and again, also, as you mentioned earlier, there is just a fatigue. People are tired of hearing about it. They're tired of reading about it. And again, say what
Yeah,
you will if
they
that is
are.
right or wrong, but that is the truth. Now,
Yeah,
I wanted
they
to
are.
quickly come over to this graph. Now, this is the same type of graph. So it's that 7-day average graph. And this is
Yeah.
2020. So while we were just taking this little walk down memory lane and talking about how high cases are now, I wanted to go rewind and look at 2020. So look at
Yeah.
this map. Again, don't pay attention. Those numbers on the right-hand side of that screen there. Might be your left, right and left's never been a talent of mine. That is since the pandemic started. That is not this graph. So if you're just looking at the graph again with that purple line, that is the moving 7-day average from 2020. So look back at where we were and then kind of mentally imagine that graph I just showed you a second ago, and you can see the differences there. You see how high
Yeah.
these case numbers are, again, before we knew anything about treatments, before we knew anything about vaccines. And these numbers looking back are still startling.
Yeah, they are. And let me tell you that my most interesting COVID story is because I wrote the story of the first person who tested positive. And at the time, AL.com was tracking, and we actually had a story, and not the people's names, obviously, unless they announced their names, but it listed the cases. Like a auto worker in Perry County has tested positive. At the time, and then, I wrote about the first COVID death. But at the time, I had no clue. I mean, it was almost like we were writing about, I hate to compare it, but like a tragedy, like a tragic accident where you profile the victims. And at the time, if you had said, well, you're going to have 1.3, 1.4 million Alabamians with COVID, I mean, my family has had it. That was mind-boggling. So I always go back and look at that old story about how naive were we to think we were going to cover everybody that had COVID.
Well, and two, if you look at these numbers on the side, you can see, and these again are since the beginning of the pandemic. So not this year, but since again, March 2020, and since this data started rolling in, again, almost 1.4 million cases there just in Alabama, and over 19,000, close to 20,000 people who have died. And you can see that number as well. Over 7,000 people died in 2020, and then over 9,500 people,
Yeah,
9,558 in 2021. So 2021 was by far the worst year for COVID so far in
it was.
Alabama. And
Yeah,
then
it was.
in 2022, about 3,000 people. Now, if we doubled that, again, we're halfway through the year, double that, it would still be the lowest year so far in the
Right. And
pandemic years of death rates. So even though things are getting better, for some people they are not. And for some people, they are still suffering these consequences. And you can see while there is a change and our daily lives have changed, when you look at the data, there's not as big of a change maybe as we would like for there to be.
No, and Alabama has always been, we have seen this from the very beginning. We saw the outbreak, it's going to start in your population centers, New York, Boston, California, and it takes longer to get down to the Southeast. So I think we're sort of seeing what New York and these other big cities saw 2 months ago. And that's been that way the whole time. And so, you just, thankfully, we have medication that can treat people. We have, I think some of the practices that changed in hospitals were great. And so we have more ways to handle things now. We're better equipped, we're better prepared, and hopefully better staffed, because I can only imagine the just complete exhaustion for the people who've been doing this for 2 years. It's exhausting for journalists. It's been exhausting, mentally exhausting to deal with it every day. And I laughed. I've said the whole time, the day I don't write COVID in a month, I will be the happiest person in the world. But there is positive that if it can become part of a daily life that we treat, and I go take a medicine like I would take NyQuil if I had the flu, then that becomes a whole different ballgame.
Well, and again, we're going to leave. There's so much data on this website, and this is all data that's collected from the Alabama Department of Health and put out there for everybody to see. So I'll leave the link there so you can play around with that data and look at it. But it is from the Alabama Department of Public Health. If you go to their website, you can find it. But I'll just leave a link here for that dashboard so you can easily see it and play around with it. Everybody who has been commenting and saying that either they are battling COVID right now or their family members are, we are thinking of you and hoping that you get better and get to the other side of that soon. Leada, we could, I'm sure, go on and on about this, but it looks like the kind of moral of the story right now is Alabama does have, again, over a 24% positivity rate, at least, not including a lot of those home tests right now in COVID. And, but the good news of that, the other side of that coin, is that the hospitalization rates are not drastically increasing.
Yep. Just take care of the people around you. That's the best thing you can do. And don't get monkeypox. Those are my two suggestions.
I just another thing to worry about. Like, I appreciate it. Thank you so much for breaking down this data and telling us about it. Again, it's something that I know we all like to forget and like to put to the back of our mind, but something that is still out there and that we should still be informed about. So thank you, Leada. Everybody watching, again, if you are sick, hoping you feel better. And everybody watching, thank you. We'll see you tomorrow.